Good evening, everyone, and thank you for joining us. My name is Sarah Every with Modernizing Medicine, and we're glad you could join us tonight. We're eager to show you how our electronic medical records system developed just for dermatologists will handle ICD-10. Following tonight's presentation, there will be a question and answer session, so please write in your questions at any time during the webcast in the questions box on the right-hand side of your GoToWebinar panel. And at this time, I will turn the webcast over to Shelley Olesen.
Thank you so much, Sarah. I want to thank everybody who's joined us for logging in tonight. I'm going to keep the PowerPoint pretty short and move over to demoing dermatology, which I know is the primary interest for everybody that's on here. But we do want to make a couple quick points here. So, by the way, I am the National Sales Director for Dermatology and Plastic Surgery, in case anybody's wondering who Shelley Olesen is. And I've been here at the company for 4.5 years, so I've seen a lot of growth here with Modernizing Medicine. So, October 1, 2015 really is the beginning of ICD-10. I'm sure that the majority of you have been holding your breath for a decade as we continue to see temporary fixes by Congress tied to the sustainable growth rate, which would have cost a 21% pay cut. So while that was a huge relief, last year's delay of ICD-10 was tied to another temporary fix, which didn't happen this year. So you should be sure to get ready now while you still have time to finish your due diligence and implement an EMR that can automate ICD-10. Delaying to the last minute will cause undue stress for you and your staff. Don't be the ostrich that sticks its head in the sand. Being prepared will help your practice to keep moving at the speed of dermatology during this major shift. This is absolutely critical as there is no option to take a penalty. Your reimbursements could simply dry up, or you could find that you are asked to repay reimbursements if you're audited and your clinical documentation isn't detailed enough to substantiate the code you selected, even if the code is appropriate for the service you provided. I know you're all very comfortable with ICD-9, and it must feel almost like losing a good friend, or at least a good biller. Even if you're manually filling out a Superbill today, it probably only takes you 20 to 30 seconds to fill one out. The shift to ICD-10 is pretty significant, so let's review how we go from 13,000 codes to over 140,000. Well, the first is that we go from 3 to 5 characters to 3 to 7 characters. ICD-9 is pretty general, actually, and ICD-10 is very, very detailed. ICD-9 doesn't care about laterality, and ICD-10 does. And ICD-9 asks for very little about clinical details, but with ICD-10, severity, other anatomical sites, etiology of diseases, those all affect the code, so you have to be really precise in your documentation. And with ICD-9, there aren't any extensions, whereas the 7th digit extension to further classify initial visit, follow-up visits versus sequela really take this to a significant number of codes and a decent amount of complication. Some common solutions that other vendors and consultants are pushing include general equivalence maps and crosswalks. This is because most EHRs lack structured data, or they know you just don't want to do an EMR. But what you need to understand is that these solutions require added clicks and take precious time away from seeing patients. So let's look at the next slide that shows how a crosswalk will work. Let's say you're looking at folliculitis, 704.8. The crosswalk, which wasn't written by dermatologists, will take you to L66.3. Unfortunately, that references perifolliculitis, which, as you know, isn't folliculitis. Folliculitis is actually found on another page altogether. Can you imagine how frustrating it would be to try and code using this methodology? Providers have asked me if they can use an unspecified code, but unfortunately, CMS has stated clearly that you will need to consider the increased specificity of ICD-10 codes compared to ICD-9. The burden is on you to ensure that patient encounters are documented with appropriately comprehensive clinical descriptions. Even though books have the valid ICD-10 codes, you'll find that you have to flip back and forth between multiple pages just to code one typical dermatology visit. Some practices that are still resisting moving to an electronic medical record are hoping that they can get away with a fee ticket or Superbill. In fact, we actually just had one of our billing clients email us asking how we were going to enhance our Superbill for her since she's not on our EMR yet, and that was kind of funny to us. So to help you understand just how ineffective that would be, we made an ICD-10 Superbill that just covers the 50 most common dermatology diagnoses. It would take a loop to figure this out, and again, waste precious moments that you should be using to see patients. Doctors want to keep it simple. You don't want to struggle with manually figuring out these complex codes, which is why we believe that Emma is the solution. As one of our users, Dr. Gary Slaughter, recently told EHR Intelligence, we really don't foresee any challenges from an EHR perspective. My staff praises Emma Dermatology all day since the algorithms that can handle the switch over to ICD-10 can already do it. They just wonder how the providers that write on paper or use client server systems are going to adapt to this change at the last minute. We don't anticipate a slowdown on October 1, nor do we expect any rejections, which are two huge benefits. Emma is an intelligent EHR that captures structured data to automate ICD-10 codes directly. The codes are built in, not bolted onto a system that was designed before ICD-10 was even conceived of. Emma can fully automate the Superbill and is driven by the note, so there is no concern that upon an audit, the note won't substantiate the codes. So let's take a look at how Emma automates ICD-10. Now you should know that we have both an iPad app and we have a computer version that can be used on any Mac or PC. This evening I'm going to touch on the ICD-10 functionality using the computer version here. So you can see that we have a home screen, and I've prepped a little patient, Ann McMillan here, and I'm going to go ahead and dive right into her visit here. It was really easy to do that, and you'll know exactly who's coming in. You'll see a facial recognition shot, any notes about this patient, and Emma helps you in this overview screen to see if there's any pieces that you've missed because they're hot pink. So let's go into Manage a Chief Complaint, and you can always follow up on previous ones, but this evening let's go ahead and add a new Chief Complaint. Emma will learn what your top 10 diagnoses are, and that happens automatically without you having to do anything, simply based on frequency of use. You can also come in here and you can drill down and find lesions, rashes, procedures, medications. So Emma is not just good at automating ICD-10. Emma really is like purchasing a textbook of dermatology that has everything that you could do at any point in your dermatologic career, even seeing a patient with leprosy one time in your whole career. It's going to be ready for you. But then it learns, just like your smart medical assistant, what you do most frequently and how you do it. So let's say that this patient has a changing mole. And let's say that this changing mole is on their back. So our 3D Anatomical Atlas is loading right here. And you can see as I hover over, it shows in purple the different sections. And up in the right-hand corner, it's going to show what we call that. And that's been around since day one. It's always been really important. You can see I can zoom in here. And with an iPad, I can just pinch and zoom. But it's really important right now with ICD-9 because we've always been helping our providers to get paid appropriately for biopsies on the eyelid or the ear. But with ICD-10, it's going to be even more important because we're going to be able to be as specific as we need to be with laterality, etc. So let's say it's itchy and it's changing color and getting darker and bigger. And you can see this is going to walk me through my HPI components. I certainly have the option to skip things if your medical assistant doesn't know how to answer that. That's fine. They can say that this has been here for months and whether or not it's been treated. And then if there's any history like this, perhaps the patient has a history of melanoma and this was on their chest, they tell you, and it was removed in let's say 2011, we can really capture that information very, very quickly. And what it does is it builds a really nice grammatically correct chief complaint that you didn't have to dictate. Now we can always add secondary complaints as well, right? So let's go ahead and do that. Let's say that the patient also tells us, and actually I just did manage chief complaint again. I want to do a secondary complaint, which is much faster. That's where you can gather that laundry list of complaints. So maybe the patient says that they've received a few bug bites recently and they're itching them, right? So we can just say, let's just say, bug bite, right? You can put it in whatever language they want to use. It's pretty flexible. And these are itchy, right? And we can hit save, or we can save and add another. Let's say that the patient is also complaining about folliculitis, right? So maybe they have a bit of a rash there on their bottom. And you can see I can change my perspective over here on the right-hand side. So if they also potentially have a little rash here in their armpits, we can comment on that, right? So maybe the patient is just calling it a rash, right? Or maybe it's an itchy rash. So we can put that in those two areas and say save. So it really allows them to very quickly add their detailed chief complaint and their secondary complaints. All right. Now, patients can go through their past medical history, medications, allergies, everything but the review of systems on the patient portal. And we really find that about 20 to 25% of patients will do it from home. The remaining practices typically like to set up an iPad kiosk in their check-in area, or maybe move some older computers from the back office up to the front where patients can sit down and go through the history. So I'm going to go ahead and gloss over that just a little bit today and show you how I can review it with one click from the patient overview screen. But let's come down to the review of systems. This is totally customizable by you. So we'll start you off with a really nice review of systems that does make sense for dermatology. And then if you're like me and you want to create subcategories like melanoma ROS, or maybe some other specific like isotretinoin, etc., then you can certainly do that. So I'll go ahead and mark custom reviewed. You can teach Emma what you want included when you do your typical new patient or your annual skin check. Now, if there were ever any previous positives, it is going to hold those here, and you can always review and say, you know what, they no longer have a problem with that bleeding. Maybe that's because they got off their blood thinners, right? But maybe they manually tell you, I don't know why, but I have a headache today. You can always manually go in and add something that they mentioned, or go through and add additional questions that you asked. When you're done, we can simply touch on the virtual exam room to go right in and start your exam, or we can come back to this visit note overview screen, which is where I want to take a brief stopover to show you how you can see all of the different sections in their patient clipboard if you've previously gathered this or the patient went into the patient portal to do so. And then you can just give yourself credit for reviewing it by touching right here. Now let's dive in and start that examination. So we can start at the top left by performing an exam. We have three primary categories here: full skin, focused, and above the waist. You can layer on appearance, orientation, and mood to get 3 more Medicare exam elements. You can add on details like tattoos and tan lines, or wheelchairs and wigs. You can combine those two. And then you have a lymph node exam for your melanoma patients. Well, since this patient mentioned that they did have a history of melanoma, let's go ahead and touch on that lymph node exam. Much like the review of systems, anything that's checked is going to be included. And we can see that that includes the palpation of the lymph nodes, etc., as well as the examination of the liver and spleen. If I wanted to make any changes, I could certainly do so, but typically you're just going to simply say done and move on to your findings. So let's go ahead and start with that changing mole, right? So just like with your top 10 chief complaints, Emma knows what your top 10 impressions are. And anything that's not on here, you can search down here below. But I do see dysplastic nevus, which is what I was looking for. I can always come to DDX, which is going to help me to rule out dysplastic nevus versus melanoma, and maybe we're hoping it's just a blue nevus. I can go ahead and say done. I can then check my morphologies. Now, Emma is going to start you off with morphologies that really make sense, both regular descriptions and dermoscopy descriptions. And then you can add things like I did, called waxy brown papule, by coming up here and adding something. And you can just tell it whether you want to just use it once or say, yeah, add it to my list. I want to use that again and again. That's a go-to morphology for me. So now Emma also learns your popular plans, right? We know that you don't want to go sifting down through all of these various plans that really cover anything that you could do for any impression in dermatology at any point in your career. You're going to want to have your go-to plans right up at the top. So let's say that I want to do a biopsy by shave. Let's say I want to put that right in this location. I can put in the size of the lesion. And from there, I'm typically just going to say done. Now, I do want to point out that other than frequency of use, Emma has this sticky learning concept. And you'll notice it's not here by the size, but it does know that it should be smart enough to learn what type of a blade you use, how you prep the skin, anesthesia, etc., right? Emma can even learn whether you like to build the 99,000 code so that you can get an extra $10 or $12 for each biopsy that you do by submitting that code with it, right? So Emma's always helping you to code at the highest ethical level. Now let's move on and let's talk about those bug bites, right? So that's not in my top 10, but you can see that I can just start typing and it makes it really easy, right? So we pull up insect bite. I can also come in here, describe it appropriately. If Emma has any question, right, it knew that with the last one, this was a new visit. But if I have any question about that initial, subsequent, or sequela visit, it's going to allow me to select that here. Let's say I want to counsel the patient. Now, counseling is built out for all of our 1,500 plus impressions. And if you change that, it's going to remember that with that sticky learning. Also, if medication counseling is appropriate, we can go ahead and touch to add that to our note. And again, you can make changes there with sticky learning. So we've counseled the patient. Maybe we're going to do a prescription of Topicort, say close, and then we're simply going to document where we see all of those various insect bites, right? Maybe we have one back here as well. Now moving on to the folliculitis, we can come in here, pull up the folliculitis. Notice how many different options we have. Again, anything that you could possibly want in dermatology. We have the option to note the body surface area covered, and you can also just come in here and manually type. It's not something we require. You can talk about the severity, any pain that they may have. And this is not just important. In fact, I don't think that this affects ICD-10, but it's great for pay for performance. In January 2015, the government announced that they are moving from pay for service to pay for performance. And if you can track visit from visit and show that the patient is improving over time, that's going to help you substantiate the codes that you're submitting. So that's really, really important as well. So let's go ahead and do a prescription for this folliculitis. Let's say that we're going to give them some cephalexin. And since we already gave them some Topicort, we can just let them know to apply that to the area as well. So let's go ahead and say close. We can touch on the areas that we're seeing the folliculitis. Go ahead and touch on the axilla here on both sides, left and right. And let's say that that's everything that we need to do here. Now, Emma has an E&M expert built in, so it's not just going to help with your ICD-10 coding, but you can see that this is putting me at a 99214, and it's telling me exactly what it's substantiating. If for some reason you missed it, right, and the rest of your visit substantiated that level 4, but maybe your MA only got 3 HPI elements and you're seeing a level 3, then this expert down here would tell you how to get to the next level. Now I know you're hardly ever going to do a level 5, but if you're expecting a 4 and you're seeing a 3, this is very, very helpful. Takes all of the guesswork out of your documentation. So let's go ahead and save the note. Now, most providers really like doing their review here. So lots of times they're having their medical assistants do virtually everything for them. And instead of looking at the PDF outputs, which I'll go to in a moment, they simply scan here. If they want to make any changes, they touch on this hyperlink. They see the exam that was done. They see where they did the biopsy. I don't know if you can see this online, but it's really easy to see that a number of photos are stacked on top of one another so you can expand and see all of the different areas. So this is a very, very helpful overview area. You can see all of the coding here and all of the codes that are tied to each of these CPT codes. You see your substantiation for that E&M code that you did, as well as your E&M advisor down at the bottom. So that's your overview area, and typically doctors just hit finalize from here. But as far as seeing an overview of what our actual note looks like and what you could submit potentially to your insurance company if they were asking you for substantiation, this is what your note's going to look like. So your logo can be up at the top left, patient information, all of the medical histories coming down the left-hand side. Emma also does an incredible job at automating meaningful use. And one of the pieces that we do to make it easy for you is that anything that you print or e-prescribe is going to get automatically added to the medications over here. On the right-hand side, you have your chief complaint with HPI, your secondary complaints, your exam. Oh, and that just reminds me, I need to add on that history of melanoma, which I didn't do. We have that neoplasm of uncertain behavior with our biopsy by shave method, our insect bite. And I want to really point this out really quickly. With ICD-10, right, it's going to be more specific, as we've been discussing, than how you normally think of your patient's diseases, right? So notice with that neoplasm of uncertain behavior, you need to add on of skin. For insect bite, it's showing you these specific things, right? For folliculitis, it's going to call it furuncle of these different areas. So not only is it showing it in the language that you recognize, but it's also making sure that, again, your note is really going to substantiate ICD-10. Down below that, we're going to have our color-coded body map with all of the various locations. And then if we took any photos or did any drawings, that would be down below. Moving along to our encounter form, we can show you that as well, right? So we can see all of the various insect bite codes, the unspecified multiple injuries, the furuncles, your neoplasm of uncertain behavior, and then all of these diagnoses pointers going into the right location. We have that substantiation right here. So as we mentioned, we take the guesswork out, and if you take the PDF of the note and this encounter form, it really substantiates everything, including medical decision-making, which we don't believe any other system has been able to successfully do to date. And this is all just built in with the Medicare 1997 guidelines with the CCI edits. Shows your problem points, any data points, if there are any diagnoses that were bundled that didn't contribute to the E&M calculation, and whether you did any transfer of care, which as we know is important for meaningful use. Your prescriptions are ready to be printed or e-prescribed. You have both of those options, and they're very straightforward and easy to do. Your path requisitions are all done. I skipped over lab requisitions because we didn't order any labs, but those would be all done as well. Just like with the path rec, the lab rec is going to be personalized to the patient. It'll show their insurance, the location, the procedure, what you want to rule out, your ICD code, and your peel-off sticky labels. Then we have our patient education handouts. I love these. The combination of the handouts and this patient education area is how we help you to qualify for that important piece of the clinical summary and patient education that's tied to meaningful use. So they'll have their post-op instructions, any counseling or prescription instructions, etc. All right here. They can print this up or they can take it home. Now I could go on and talk about how we also put all your specimens automatically on the path log, how we can send out your specimens and your requisitions out electronically to your path lab and have those results come in electronically. Emma does so much in that it will turn any cancer that you find on the path log and put it on the patient's cancer log, which then allows you to follow it with interval history. And we do a ton for automating Mohs, cosmetics, etc. You name it. If it's in dermatology, we handle it. But since we're focusing really on ICD-10 today, I'm going to say that that's enough for the demonstration and open it up to questions and really address things that are important to you.
Great. Shelley, thank you so much.
If anybody has any questions, yeah, go ahead, Sarah.
Yeah, great. So we would love to open the floor up for questions at this time. And again, if you'd like to submit any questions, please do so by typing in your question into the questions box on your GoToWebinar panel. It's on the right-hand side of your screen. Okay, so I see some questions coming in. How long does it take me to implement Emma?
That's a great question. So implementing Emma is a lot easier than implementing another EMR because you don't have to build your templates and you simply need to learn how to use it and then start using your live site, practicing your typical patients. And as you practice and really solidify what you've learned during your lessons, that's how the system is tailored. With that being said, there are still some processes. So the thing that takes the absolute longest is putting the interface in place between the practice management system that you select and Emma. So we can integrate with your existing practice management system. We've integrated with over 400, and we also have preferred partners if you're looking to move away and you're concerned that your practice management system is not going to be able to handle ICD-10. But regardless of what you select, on the shortest, it's going to take about 6 weeks to put that interface in place for your practice management. And on the longest, it can take 10 or more weeks. So that's the main thing, that you don't want to cut close and wait to the last minute to sign up with Emma, because you could be ready, but the interface with your practice management might not be ready. Then we have your two different styles of learning, right? Many providers really like to learn in 1 hour web training increments. So we do have 9 one-hour lessons. We recommend that you do them twice a week so that you finish them in about a month. If you do this, there is homework in between each lesson. And so you'll spend, let's say, an hour with an educator on Mondays and Wednesdays, and then on Tuesdays and Thursdays, it's going to take you anywhere from 30 minutes to an hour to go through your homework. And by homework, I mean just doing sample visits in Emma, right? That's what makes it all gel for you. Once you've gone through those 9 lessons, actually, that's when we want you to start practicing in your live site. And that's where all that customization takes place. So that takes another 1 to 2 weeks, depending on how much time you're able to invest in that. So probably about 2 weeks. So if you're going with the web training, that's going to be about a 6-week period. And you typically can't start training the day you sign, right? It's going to take probably a week or 2 from the point of signing to starting training. So you're looking at about a 2-month period. If you go with a weekend workshop or even a midweek workshop, we can fly an educator or even 2 educators out to your practice, depending on the size, and they can do all of the training over a weekend or midweek if you want to close a clinic, but we do respect how expensive that is, so most people don't want to do it. But you will want to watch 3 one-hour introductory videos. You'll want to do the homework, so that's about a 6-hour investment before they come. Then you'll train Saturday 8 to 5, Sunday 8 to 4, and then after that, that's when you do that 2 weeks of practicing in your live site. Now, once you finish all of your training, regardless of what method you do, and you've done your 2 weeks of practicing / customization in the live site, that's when we want you to start phasing in Emma. Now, you could certainly go cold turkey, but again, we're really focused on not negatively affecting your revenue, right? So by phasing it in, even if you have an existing EMR, if you just start with maybe just new patients in Emma, or if you just do maybe your last hour of patients or your last 30 minutes before lunch and your last 30 minutes before the end of the day, and slowly work your way up to doing all of your patients, it really reduces the stress. So if you're going in that phased-in approach, it's going to take about a month to go from little bit by little bit to 100% live. So you really are looking at about 3 months total from the point of signing to be 100% live on Emma if you take it slowly and methodically and don't stress yourself out by trying to dive in too quickly.
Great. Thank you so much for that. I see a couple more questions that are related. Do I still have to have a server in my office? And is there any other hardware I need besides computers?
Yeah, that's a really good question. So Emma is in the cloud. We host it in Amazon's web services, and we actually replicate it in triplicate. So, for example, if you have your database in Virginia that we're hosting from, we'll also replicate it, for example, in Northern California and Arizona. So you don't ever have to worry that Emma's going to go down. We have engineers manning it 24/7. And we had only 5 minutes and 26 seconds of unplanned downtime in all of 2014. So you're going to be fine in that regard. Now, as far as a server is concerned, that really depends on whether you are using a practice management that's in the cloud or whether your practice management is still on your server. If it is, then you will still need to maintain that server, but you won't need to add EMMA to it, which means that you won't need to upgrade it and add all of this extra power or build in a terminal server to help you to manage a client server EMR at multiple locations. That's a total non-issue for EMMA. With us, any computers that are 2 or 3 years or newer should work just fine. But the majority of the people really like using the iPad in the exam room. And iPads are so inexpensive. They're only $500 to get the latest and greatest iPad 2. And that's what you really want. It's going to be the fastest. It's going to have the best photo clarity, etc.
Great. And the next question is a little bit related. What happens if my internet connection goes down?
Okay, great. So with Emma, you're going to be able to count that it is going to be up and in the cloud. We can't control your internet connection quite as much, but there's a lot that you can do to make sure that you're in good shape. So the first thing that we recommend is that you purchase a dual WAN, and let me spell it out for you so you know what I'm talking about. Dual WAN, D-U-A-L-W-A-N. Dual WAN is great because it not only is a firewall for you, but it also allows you to plug in 2 different internet connections. So one we recommend is broadband, and we're not talking T1. T1 is very expensive and it's very slow. We're talking more like Comcast or Uverse, something like that. So plug that in. You'll also want to keep a DSL connection. The reason is that broadband goes through the cable lines, DSL goes through the telephone lines, and so you're using 2 completely separate and distinct networks to connect to the internet. This does load balancing, so it's going to be pushing your load across both connections all times, and if one goes down, it'll switch the entire load to the other connection, and you won't even realize it. Emma may just seem like it's a tiny bit slower. Now, if you can't get both of those connections, or you just want to be extra safe and have a triplicate option, then you may want to go with an LTE device. So those are really great. You can have those from Verizon, from T-Mobile, something like that. That's where you can take that cell phone connectivity and have up to 10 devices, 10 iPads, for example, all running off this little device. And that can be a really great backup for you that's not terribly expensive.
Great. I see one more question. How does your system update? Do I have to pay for upgrades or updates?
Yeah, great question. So with our fees, Emma includes all of your upgrades. If we need to do an update for ICD-10, for meaningful use, or just a new laser that came on the market, that's all included, and you're going to get that right away.
Great. Well, I think that's all the questions we have for this evening. Shelley, do you have any closing remarks?
No, well, I want to thank everybody one more time for coming in. Thank you for your good questions. I want to encourage you to move forward with Emma in the next week or 2, because if you haven't noticed, we are right about 3 months away. So, or actually, let's see, are we July, August, September? Nope, we're just under 4 months away. So that's going to give you just enough time to do this in a non-stressful way. You've waited this long, don't stress yourself out, implement when it's easy for you to do so, and be ready to go through ICD-10 without worrying about your revenue stopping.
Great. Well, thanks again, everybody.
Thank you, everybody. Have a wonderful evening.
Have a great evening.